they say in medical presentation, there are two kind of speakers, those that have something to say and those with slides. So I'm obviously in the latter group here to try to keep you entertained. But I want to thank Craig and also Lindsay for inviting me to participate in this forum. It's a great honor to be here. I am a neurosurgeon, which means I take care of folks with brain injuries and problems, but I do have a lot of experience in relationship with athletes. I've been working with athletes at various levels for the past 15 years or so, and I had the good fortune to be involved in a couple of professional teams, taking care of the NBA team in Memphis when I was there for 12 years, and now the National Hockey League team in Nashville, as well as a variety of college teams, and then even some other sports that have come and gone, like the XFL, if any of you remember some of those minor league football teams. But so athletic head injury has been a big interest of mine through the years, and Craig asked me to give you actually two separate presentations. This one a little bit about traumatic brain injuries. I want to kind of give you a flavor for what are we seeing, what are we doing, how do we make assessments, what is the scope of the problem, and what's changing in our assessment pattern. So I'm going to talk just very briefly about definitions, what we're really facing, how we define these injuries, what happens to the athlete, how we diagnose them, and what the outcomes are. I thought it was an interesting historical perspective, though, for this meeting, that back in 1905, American football was becoming popular. There were 18 deaths that year, 159 serious injuries. And so at the time, Theodore Roosevelt was president, and he decided this was a national tragedy. So he convened representatives from academic institutions and formed a committee to look at this problem and to discuss the rules of the game. And that committee met and eventually expanded to about 13 institutions, and then in 1906 was chartered, and in 1910 that group became the NCAA. So actually the organization we now know as the NCAA was founded by a visionary who was disturbed by the incidence of head injury in the sport. And I think if you look back at the previous slide, it's not too far a stretch to imagine Dr. Farrell standing there with his head on, kind of looking a little bit like Teddy Roosevelt. So, I thought there were a lot of parallels to this meeting, just like Teddy Roosevelt did. So a couple of quick definitions. You hear these terms thrown about. What do they precisely mean to us? Well, TBI, or traumatic brain injury, is any injury to the brain producing a structural or functional alteration. This can be very mild, or so-called mild, which we think of as concussion, or severe cases with coma and even death. Concussion is simply a transient alteration in brain function induced by trauma, with an emphasis that it does not require a loss of consciousness. And believe it or not, that's still a point of misunderstanding among a lot of folks. You don't have to be knocked out to have a significant brain injury. Another term you hear a lot about these days are CTE, and I think that's something that is going to